Hello friends, how you doing everyone? Hope everyone is doing great. Okay, today we will discuss about a vitamin, the one important vitamin, that is vitamin D. Why we are today we are discussing, because the vitamin D deficiency is most prevalent in our country, India. You won't believe around 85 to 90 percentage of the population is deficient in this vitamin D. So we all know that vitamin D is also called sunshine vitamin. There are many forms of vitamin D. In that, the most important form is vitamin D3, that is cholecalciferol. The cholecalciferol is synthesized in the skin epidermis. The cholecalciferol is itself, it's not an active form. It has to undergo hydroxylation in order to convert into active form. So there are two hydroxylations happening with this cholecalciferol. The first hydroxylation happens in the liver, in which it is converted to 25 hydroxycholecalciferol. The second hydroxylation is happening in the kidney, in which it is converted to 1,25 cholecalciferol, and final product in this hydroxylation, it is calcitriol. What are the so this is the calcitriol is the active form of vitamin D3. So what are the functions of calcitriol? The normal function of the calcitriol, it helps in the intestinal absorption of the calcium and phosphorus and get it deposited in the bones. So the bones will become mineralized and it will become strong, right? And so what happens in the case of vitamin D3 deficiency? The vitamin D3 deficiency leads to defective absorption of these minerals, calcium and phosphorus, and defective deposition in the bones, leads to softening of the bones. So we call this condition in adults as osteomalacia, and in children we call this condition as rickets. Apart from this problem, the vitamin D3 deficiency, it is also linked with many diseases, like the recent researchers say it is linked with the depression. Vitamin D3 deficiency is linked with depression, diabetes, hypertension, cerebrovascular diseases like stroke, cardiovascular diseases like myocardial infarction. So actually, apart from this intestinal absorption and deposition of these minerals, the vitamin D3 is also important in boosting the immune system. Like the vitamin D deficiency, it is also linked with some respiratory viral infections, and also the vitamin D3 deficiency, it's also linked with incidence of TB. And the recent the coronavirus pandemic, so a lot of doctors, they are prescribing vitamin D in order to although there is no conclusive evidence that vitamin D3 will decrease the incidence of COVID-19. Still, the lot of doctors are prescribing vitamin D supplementation in order to boost the immune system. And actually, in our country, India, around 85 to 90 percentage of the population is deficient in vitamin D. The normal the normal blood level of vitamin D should be around like 30 nanogram per ml, and if it is less than 20 nanogram per ml, so it is vitamin D deficiency. Sorry. So what, like in Western countries, usually all the milk and juices are fortified with vitamin D3 in order to prevent the vitamin D3 deficiency. So in our country, we are not using that actually. In our country, there are a lot of abundance of sunlight. So but still in our country also, this vitamin D3 is prevalent. So what are the symptoms of vitamin D3 deficiency? In vitamin D3 deficiency, the persons usually gets fatigue, muscle pain, irritability, and muscle cramps like this, and especially the muscle bone pain, and all this, etc. All this symptoms the persons might get. So all of you get your vitamin D3 level checked today, and if it is low, then you please take vitamin D supplements. And the vitamin D, it will increase your immune system also. It will increase your immunity, as well as it helps to prevent it helps to, but not 100 percentage, yes, somewhat it reduces the incidence of like diabetes, as I already told, diabetes, hypertension, myocardial infarction, stroke, as well as it also helps to reduce some cancers also. So please kindly get your vitamin D levels checked, and if it is low, kindly take vitamin D. Okay, guys, thank you very much. Have a nice time. Thank you. Bye.